Welcome back to the Best PT podcast. This is episode 19, talking about electrotherapeutic modalities. A little bit about electrotherapy. Therapeutic effects: decreased edema, pain, disuse atrophy, facilitation of healing, the improvement of range of motion and circulation, muscle strength and re-education, and the promotion of relaxation. Indications: Bell's palsy, decreased range of motion, facial neuropathy, fractures, joint effusion, muscle atrophy, muscle spasm, muscle weakness and pain, open wounds, and stress incontinence. Contraindications: cardiac arrhythmias, cardiac pacemakers, cancer, osteomyelitis, treatment areas over the uterus in a pregnant woman, over the carotid sinus, over a area with a bladder stimulator, phlebitis, or seizure disorders. Electrodes: remember that the cathode electrode is the negative electrode. The cathode is the negative electrode, and the anode is the positive electrode. So anode, positive. I like to think of a cathode ray tube, which is the old tube TVs, which are huge and heavy and disgusting. So cathode, negative. When you place electrodes close together, the current will affect superficial tissue more often, and when the electrodes are placed far apart, the current will affect deep tissue more often. A monopolar technique is used with wounds, edema, and iontophoresis. One electrode serves as the active electrode, and the other serves as the ground electrode. And a bipolar technique is used for weakness, NMES, and range of motion. Durations: short durations for small muscles and long durations for large muscles. And the higher the frequency results in muscles firing faster, and frequency is usually referred to as pulses per second, or a PPS. So neuromuscular education stimulation, NMES, should be used at 35 to 50 pulses per second, 6 to 10 seconds on with 30 to 50 seconds off, with a 1 to 4 second ramp time. And the modalities book says 10 contractions minimum and 20 contractions maximum per day, 3 days per week. I'm sure any of you that have used NMES have used it for hundreds or thousands of contractions in one treatment session. Transcutaneous electrical nerve stimulation, or TENS. Conventional TENS is short duration, high frequency, between 30 and 150 pulses per second at a low amplitude. The intensity should be below the motor threshold, so you should not elicit a motor response. Pain relief is only effective when the current is active. Acupuncture-like TENS is a long duration, low frequency, 2 to 4 pulses per second, with a moderate amplitude. The intensity here should cause subtle muscle twitching. This provides long-lasting pain relief after a session of 20 to 45 minutes. Brief intense TENS is a long duration, high frequency, 60 to 200 pulses per second, with moderate amplitude. You should be eliciting strong paresthesia or a motor response. And then noxious TENS is a high density current that is uncomfortable or painful, applied in 30 to 60 intervals to motor, acupuncture, or trigger points. Interferential current, or IFC, involves using 4 electrodes, 2 sets of 2 electrodes to deliver medium frequency current. The current overlaps to combine high amplitude waveforms, or beats. This allows for pain relief, increased circulation, and muscle stimulation. Different types of IFC delivery: bipolar delivery uses 2 electrodes and 1 channel to create an oval-shaped current field. Quadrupolar delivery uses 4 electrodes and 2 channels to create a 4-leaf clover-shaped current field. And quadrupolar delivery with automatic vector scanning allows for a large circular-shaped current field. Iontophoresis indications: pain, calcium deposits, fungal infections, inflammation, ischemia, keloid scarring, muscle spasms, myositis ossificans, plantar warts, scars, and wounds. Contraindications: you should not give iontophoresis to someone who is allergic to the drug in the solution or someone with sensitive skin. Dosage for iontophoresis is referred to as milliamp minutes. So multiply the amplitude by time. The normal dosage is 40 to 80 milliamp minutes. For example, a 40 milliamp dose could be delivered in 10 minutes at 4 milliamps. The same 40 amp dose could be delivered in 5 minutes at 8 milliamps. And remember that a higher amplitude and shorter duration treatment time can cause burning of the skin. Electrode placement. Electrode with the ion solution in it is considered the active electrode. And dispersive electrodes should be placed a diameter away that is at least equal to the diameter of the active electrode. And remember, the principle here is that the ions in the solution of the active electrode are of a similar charge, so when that electrode turns on, it pushes those ions away from the electrode and into the body. So negative ion solutions, these will flow from the cathode or the negative active electrode. Acetic acid is used for calcifications. Calcium chloride is used for scars or spasms. Dexamethasone is used for inflammation. Iodine is used for scarring. And salicylates are used for pain and plantar warts. And then positive ions, these will flow from the anode active electrode or the positive active electrode. We have copper sulfate, fungal infections, lidocaine, pain and inflammation, magnesium sulfate, muscle spasms and ischemia, and zinc oxide, wound healing. I like to remember these four as the positive, and then all the rest are negative. These are easy to remember as positive because they are all metal ions. So copper, magnesium, zinc, they're all metal. Electromyography is the evaluation of the function of anterior horn cells, neuromuscular junctions, muscle fibers, and this is performed via needle injection with electrical current run through the needle. This is actually illegal in most states, and that only 177 physical therapists have been given the board certification to do this since 1986. The theory with EMG is that normal relaxed muscles are electrically silent. So abnormal potentials, both spontaneous and voluntary. Spontaneously abnormal potentials. Fibrillations often occur due to lower motor neuron disease. Positive sharp waves indicate a denervated muscle at rest, such as in muscular dystrophy. Fasciculations are due to an irritation or degeneration of the anterior horn cell, nerve root compression, or muscle spasms. And repetitive discharges are due to anterior horn cell lesions. And then voluntary abnormal potentials, polyphasic, are due to myopathies, usually peripheral or muscle nerve damage. And finally, biofeedback, therapeutic effects, decreased accessory muscle use, spasms and pain, improved muscle strength and neuromuscular control, and muscle relaxation. Indications: bowel incontinence, cerebral palsy, hemiplegia, impaired neuromuscular control, spasms, weakness, pain, spinal cord injury, and urinary incontinence. Contraindications include skin irritation at the electrode site and a condition where muscle contraction would be detrimental. That's it for episode 19, talking about electrotherapeutic modalities. Episode 20 will talk about phototherapeutic modalities. As always, the outline will be in the show notes. Thanks for joining me.